Imagine walking into a hospital in America, thinking you'll get quick care, and instead you leave wondering if you accidentally bought a luxury car instead of treatment. That's exactly what happens when Australians witness the American healthcare system in action. And let's just say, they aren't holding back. Welcome back to my channel. If you're new here, please subscribe, like my video, and turn on notifications so you don't miss our next update. It starts innocently enough. An Australian tourist comes to the US, perhaps for vacation, work, or study, and suddenly finds themselves in need of a routine checkup. Nothing dramatic, just a simple consultation. But as soon as they walk in, their eyebrows raise. The paperwork alone is enough to cause a minor panic attack. Forms for insurance, forms for consent, forms for agreeing to pay for things they didn't even know existed. The Australian glances around, expecting friendly, relaxed staff like back home. Instead, there's a receptionist staring at them like, "Do you even know how much this is going to cost?" When the consultation finally happens, they notice something strange. The doctor asks a few questions, performs a quick exam, and casually mentions a few tests that might be necessary. They hand over a bill, and the numbers are astronomical. For something that back in Australia would cost maybe a few $dozen, the price tag here is in triple digits. The Australian is stunned. They glance at their American friend, who shrugs nervously, whispering, "Yeah, this is normal." Then come the insurance complications. Australians are used to a system where you show your card, get care, and maybe pay a minor fee if it's private. In America, it's a battlefield. The hospital staff checks insurance, tells you certain procedures are covered, then tells you they're actually not. Australians quickly notice patterns Americans might have normalized. The upselling of treatments, the endless list of optional tests, the necessary scans that might or might not do anything, all designed to drain wallets under the guise of care. It's subtle, it's systematic, and it's shocking. A trip to the pharmacy adds another layer. Australians pick up their prescription and casually ask how much it will cost. The pharmacist, smiling politely, recites a number so high it could cover a weekend getaway in Sydney. The Australian blinks, then laughs nervously, because it has to be a joke, right? It's not. And then the reality hits. The American system is built in a way that rewards complexity over clarity, profit over access. Australians notice that Americans might nod and pay, but to an outsider, it looks like everyone's been trained to accept absurdity as normal. Hospitals in America feel like luxury hotels that charge per feature. Need a bed? That's extra. Want fluids? That's extra. Want painkillers? Extra. And don't forget the mandatory processing fees, facility fees, and random charges for items you didn't even see. Australians take out their phones and start comparing notes with friends back home, posting screenshots and shaking their heads. To them, this isn't just expensive, it's a scam cleverly disguised as healthcare. In the emergency room, that's when things get really wild. Australians notice the contrast immediately. In Australia, ER visits are treated with urgency, everyone gets care, and costs are negligible if you're a citizen. In America, the experience is a mix of chaos, waiting, and anxiety, often with outrageous bills attached afterward. Australians quietly record, compare, and share these experiences, highlighting the shocking disparity. They notice that minor issues are billed like major procedures, optional tests are suggested without necessity, and "you can't afford it? We'll work with you later" is the polite way of saying good luck. Social media amplifies these experiences. Videos start circulating of Australians quietly documenting every absurd charge, every unnecessary test, every insurance loophole. They poke fun, they expose, and they educate. The message spreads. While Americans might shrug and say, "That's just how it is," Australians see it clearly for what it is, a system that preys on confusion and complexity, often leaving ordinary people financially burdened after basic health care. Even everyday conversations reveal cultural differences. Americans casually mention medical bankruptcy as if it's a normal life event. Australians are baffled. Back home, they pay taxes, get health care, and rarely worry about bills stacking up for a simple checkup. They ask questions like, "Wait, you mean people go bankrupt just for getting a flu shot?" And the answers, sometimes shrugged off by Americans, sound absurd. To Australians, it's not absurd. Yet, it's not all doom and gloom. Australians also notice that the system is so layered and complex that it's almost comical. The upselling, the hidden fees, the jargon, it's like a carnival game disguised as medical care. Videos of Australians reacting to American bills, comparing them to the same treatment in Sydney or Melbourne, and shaking their heads in disbelief, go viral. The humor isn't mean-spirited, it's observational, highlighting the difference between necessity and profit-driven necessity. By the end of their trip, Australians have not only learned about American healthcare, they have become minor investigators, exposing the scams, sharing tips, and teaching friends back home how absurd things can get. They laugh at the irony, post screenshots online, and even create memes. In America, your hospital bill comes with a mortgage application. Americans may take offense, but the truth is clear. Outsiders notice what insiders accept as normal. The ultimate climax comes when Australians compare experiences. A simple dental cleaning, a routine X-ray, or a mild infection can cost hundreds or thousands in the US, yet be completely covered or minimally charged in Australia. The Australians nod knowingly, shrug, and maybe sip a flat white. They've seen it, documented it, and now the world knows too. They've exposed a system that thrives on complexity and costs, and they do it with humor, clarity, and no shouting. Just observation. And for those watching who are curious about what happens next, Part 2 dives into the most outrageous, jaw-dropping American hospital bills ever experienced by Australians, and how they expose them to the world, making Americans question if they've been overpaying for decades. Stay tuned, because this is where confidence meets reality, and nothing looks the same ever again. Just when the Australians think they've seen it all, the next hospital visit hits them like a punchline with a price tag. A routine blood test, something that back home would barely cost a coffee, comes with a bill so high it makes their jaws drop. They start asking questions. Is this real? Did they just charge $200 for a vial of blood? The nurse smiles politely and says, that's standard. Australians exchange looks of disbelief. Standard? Back home, this is absurd. Then comes the emergency room chaos. An Australian friend trips on the sidewalk, a minor sprain, nothing serious. In the US, that sprain requires X-rays, consultations, and optional treatments. By the time the paperwork is done and the bandages are applied, the bill is higher than their flight tickets. Australians start recording, making notes, and even joking to the patient, "Congratulations, you just bought a first-class healthcare experience." It's absurd, frustrating, and laugh-out-loud ironic. Even routine prescriptions become a source of shock. Painkillers, antibiotics, and allergy medicine are all priced like luxury items. Australians quietly snap photos, compare notes, and post them online, pointing out exactly where Americans are being overcharged. Their commentary is sharp but humorous, showing the system's flaws without being mean-spirited. Americans might shrug, but to outsiders it's impossible not to see the pattern. The system is designed to maximize revenue, often at the expense of common sense and basic care. By the end of these encounters, Australians have essentially mapped out the American healthcare scam. They laugh at the ridiculousness, shake their heads, and share their findings with friends, family, and online audiences. Simple checkups, minor injuries, even prescriptions. They expose them all. And viewers realize the truth alongside them. This isn't just expensive, it's exploitative, confusing, and a cultural shock for anyone used to universal healthcare. The takeaway? Australians walk away not only entertained but enlightened, having documented the absurdity, shared the knowledge, and reminded the world that healthcare doesn't have to be a gamble with your wallet. And for the next part, who knows what outrageous bill or optional procedure will make them laugh, cry, and shake their heads next?